Welcome to Green Time. I'm host Don Fitz. This episode we're going to be talking about employer-provided health benefits in small businesses. And with me I have a couple of people who have had small business. I have Pam Gronemeyer, who is a physician and has a health-related small business. I have Lou Prince, who has been co-owner of Vintage Vinyl for how many years?
35.
35 years.
We're retired now.
But retired now. And so I want to thank both of you for being on the show and sharing your experiences as being a small business owner with us. Now, Lou, what have you provided health insurance to your employees at Vintage Vinyl? First of all, how many employees does Vintage Vinyl usually have?
The average is usually 12 to 14 full-time and an equal number of part-time. So 24, 25. At different periods in the company's history, there are as many as about 35 or 40.
Okay.
So it's a big chunk of year.
It's a big chunk of money to provide health coverage.
Yeah. Okay. And we didn't start out doing it. You know, my business partner and I were defrocked musicians. The idea of health coverage was so far away from us that it never even occurred to us until Tom got married. And he had a wife, and she wanted health insurance. And then a baby was coming, and health insurance became a real big issue. And we had very few. I don't even know if we had a full-time employee at the time when we first went out and started searching for health insurance. And I first ran into this labyrinth.
And Pam, what about you? Have you? What's your history of health insurance?
Initially when I went off on my own, I didn't provide health insurance because most of the people I had hired had their husbands or spouses had insurance, and including myself. So at that time when I had health insurance for the two people who needed it, I could get into single policies for people. But what happened about the year 2004, I could no longer get single insurance policies for people who had any underlying problems like diabetes, pre-existing conditions.
Okay.
I couldn't get it. So therefore I had to go find an insurance broker and create a small business plan.
Wow. And so it sounds like it's really changed over the years for both of you, and it's really been different. How have the benefits changed over the years? I know the pre-existing conditions is a really big issue.
Well, the pre-existing conditions, when we started, I did, with the small business, they had pre-existing conditions, but what they did, they rate them. So all of my employees, when I signed up, including myself, we had to fill out a healthcare summary. And I had to, at the time I signed up, we had to have a large, like 80% of the people who worked there had to be put in the healthcare business. So therefore, then we started with the business, and I believe that healthcare is a human right and that my employees are the best part of my business. So therefore, I pay the premiums for my employees and their dependents. So basically, they're responsible for their copays and deductibles. So I tried to get them a low deductible and I tried to get them a low copay. And I didn't want to go in an HMO or PPO because I wanted them to have choice of doctors. So basically, over the years, we've seen some adjustments in like the how much the copay is and how much the deductible is, but I've always tried to keep it so that I'm paying the bulk of as an employer, I'm paying the bulk of the healthcare costs.
Lou, what about you?
We were very much doing the same thing, that we pay the copays, we pay all the premiums, and try and keep the copays low, because for us part of it was keeping people at work. That when we have a very good staff, and it's a very tight staff, and they work really hard. And when one is missing, it's hard on everybody else. So we were always looking for ways to keep people healthy. And we also pay for the families the same way, or did. It's changed in the last year or two because of Obamacare. And so we ran into the same issues. In essence, what you're doing is dealing with pre-existing conditions every year, because annually we would go to our insurance agent and shop health insurance. And it's basically a month out of my life as a business person.
That's incredible.
Where I'm not running my business. I'm primarily worrying about or going through health plans and trying to figure out with insurance companies, they don't make it easy. Trying to figure out what this insurance company will do with the person we hired this year who's now eligible for insurance and may have a specific medical issue or the medical issue that came up this year. And often you get locked in with one insurance company for 2 or 3 years, even though they're not the most efficient, they're not the most cost effective because of the person with the pre-existing condition. And you can't really change your insurance because of it, or the entire rest of your insurance pool gets screwed, basically.
Yeah.
Pre-existing conditions, you have to remember that it's age. So if you have a steady, good workforce and they're getting older, they're increasing the premiums. So at some point you reach a point where you're paying, like, for a family, for like a couple, $2,500 a month.
Did you ever have the experience that I've had that you that a company stops doing business in Missouri at the end of the year and suddenly there's no coverage for you? I mean, that must be a real pain for an employer.
We actually had
to
one
do that.
company die during the year. That they just went out of business.
So you have to spend several more weeks
Right.
Finding out what you replace that with.
And I was lucky. I had a great agent who had anticipated it somewhat and warned me. I think this company's in trouble. It's one of the reasons their rates were so low. they underestimated the pool that they were dealing with. But yeah, and at that point, you enter the roles of the uninsured. And going to an insurance company from one insurance company to another is much easier than going from being uninsured, where you are basically you're Typhoid Mary to them.
Okay. Now the insurance premiums have increased over the years, have they not?
For the most part.
Okay.
For the most part.
And can you predict these increases? Like, do you know that it's going to be 7% a year, 3%?
No. Every year I have to wait like for October, November, and then I hear what it is. So some years it's been 16%.
That's incredible.
And then sometimes you can get a reprieve, and for some reason they'll give you a reprieve. But then what happens? One year it was too high, and I had to raise the deductible, and it killed me to do that.
And we had to do that too. From year to year, sometimes we would raise the deductible just to keep the premiums at a place where we could actually afford them. And often, nothing had changed in our group except half the group or 2/3 of the group had gotten a year older. In general, it was a very healthy group. You know, they're young, active. The Vintage Vinyl's staff are musicians, DJs, dancers, performers of various kinds. They're in the world. They're doing stuff.
Okay. We're going to take a break now, and we're going to look at a few clips from the movie Fix It, which is about problems with the American healthcare system, and we'll be back in just a couple of minutes.
Every employer I know, and I'm talking about small to medium guys mostly, they dread the next hike in their insurance rates. So we've got people who fear they're going to be put out of business if they have one employee or one spouse or one child that has some kind of a huge healthcare event.
The current costs of the system are becoming intolerable. And as they become intolerable, their business naturally is going to look for other solutions.
It distracts businesses from doing their primary function, precludes them being able to budget for hiring, for investment, for expanding their enterprise.
Why are we creating an extra hurdle for business? It's tough enough out there. You know, why are we making it harder for people to provide goods and services to the American public while employing people and providing tax revenues?
I often ask folks that I work with who own businesses, tell me one thing in your business that you spend, the kind of money you spend on health insurance that adds no value to your business. There's a middleman, an insurance company, that isn't improving your employees' health, that isn't saving you money, and that is not doing what's best in the best interest of our economy.
Healthcare costs are going up 2 to 2.5% above the projected growth of gross domestic product. So it is running away from us. Healthcare costs have gone up to $3 trillion.
We've gone from 7% of the economy back in 1971 being healthcare to 18% today.
When the rest of the world is spending less than 10% of their economies and getting health care to all of their citizens.
We're here at the Bethlehem Wastewater Treatment Plant here in Bethlehem, Pennsylvania. In this piece of equipment behind me is a 40-year-old piece of equipment that's been basically taken out of service. We've got a rental unit that we now pay $17,000 a month to lease that piece of equipment. So that $17,000 of additional cost, monthly expense, is going to get passed on to the sewer customers in a form of rate increases. And this plant in general is just one small example of what the true impacts are of the spiraling costs of healthcare and our inability, whether it be here in the city or as a country, to address the infrastructure needs that we have throughout this country.
Welcome back to Green Time. I'm host Don Fitz, and with me I have a couple of people who know what it's like to provide health insurance for employees in a small business. I have Lou Prince, who is former co-owner of Vintage Vinyl, and I have Pam Gronemeyer, who has her own business with providing medical care. Now, I wanted to ask you, Pam, before you told me that I should ask about how do you increase revenues when fees are fixed? What do you mean by that?
Well, I mean that if my fees are going up for health care, for my health insurance, I have to find other sources of revenue. I'm a service-based business, so the only way I get more business is more money is by getting more accounts.
Right.
And I mean, because basically, if you know how physicians are paid, we're paid on fee schedules. So I don't get what I charge. I get what Medicare or what all the insurance companies agree to pay or what Medicaid agrees to pay. So therefore, the only way I can make more revenue is to find more accounts, which I have been able to do. But in general, that means I'm working a lot more hours for the work.
A physician then has to either work a lot more hours or spend a little bit less time with each patient. Would that be correct?
Well, no. Remember though, I'm a pathologist, so
Okay.
I look at specimens. So therefore, I have to get more specimens. And basically, signing out the specimens is what the pathologist does. We're the ones that are charged a fee. So therefore, I have to go out and get more billable accounts.
Right. Lou, has this been an issue for you?
Yeah, retail business is essentially in the same position. We can't just raise prices. So you explain to your workers, look, here's what healthcare is going to cost us. Here's how much more we have to generate. And you can't raise prices because you're competing with everybody else. And for us, we were competing almost entirely with businesses not paying healthcare, who did not have long-term full-time employees who they were giving raises annually and giving bonuses to annually in order to keep. So our labor cost was not in line. It was actually significantly higher to begin with. So you have to rely on your employees, and one of the benefits of paying for your employees' health insurance is you get to keep them. And employees you keep have more than just a day-to-day investment in the business. They see it as a long-term enterprise for themselves. So my employees were constantly figuring out ways to save me money, ways where places where we could increase our markup. In our business, we were a college of experts. There were 2 or 3 experts on rock and roll, 2 or 3 experts on blues, 2 or 3 experts on jazz, and every area they were experts, and their job was really to stay in touch with the market for those things, and as the value of specific pieces in their area went up, the price would go up. At the same time, the prices also go down on some things. It's complicated. It's really complicated.
And I think that brings us into issues that have to do with national health insurance. Is that if you have if you're trying to compete with people who don't pay health insurance, then that's a powerful incentive for a business not to pay health insurance. And
you bet.
Of course.
You bet. And it's really a plague in retail. And it makes retail employees sort of fungible, and they turn over, and it leads to instability in those people's lives and in their health lives. The only reason that health insurance is attached to employment dates back to World War II. There was a shortage of male manpower, and in order to lure people into the jobs that were necessary for the war effort, a lot of the bigger companies, the automobile companies who were building tanks and jeeps, and the companies that were supplying the army or supplying the armed forces, offered health insurance as an incentive to A, hire people and B, retain people. And so it became a sort of standard benefit in American industry. We're talking 70 years ago.
It's an anachronism.
But it's not now.
It's an anachronism. I mean, it's something that we inherited, and that's how it's been built in, but it clearly is not the perfect way
It's
to
an
go.
incredibly inefficient way to do this.
Both of you, I think, have hired part-time employees, right?
Oh, yeah.
And can you afford to pay health insurance for part-time employees?
Well, for my first of all, my part-time employee wanted to be a part-time employee because she had children, and she went down to part-time. So therefore, I mean, it doesn't make any sense to do part-time. I can't, first of all, afford it because I'd be paying twice her salary or more than twice her salary because the health insurance would cost me more than her salary.
Wow, that's real. And of course, a lot of people can't work more than 15 or 20 or 25 hours a week.
Yeah, a large percentage of my part-time people, one of the problems in the record industry is you have to keep making your staff younger. And if you want to retain your management and your expert staff, you have to turn over a certain number at the lower level, at the work in the store for 15 hours a week level. And we're lucky our store is right next to Washington University. It's in University City, which has a vibrant young high school age population. So we always can find the right kid, the right student who wants to work 10 hours and knows a lot about current dance music or current hip hop or whatever. So they want the part-time job. Fortunately for us, a lot of them have their health insurance through the institution they're going to school in or through parents. And one of the improvements under the ACA, under Obamacare, was parents can insure their children up through age 26. My youngest son just got off my health insurance.
So that's a real problem.
And he's a school teacher in San Francisco.
If you're hiring a 30-year-old who really needs to work only 25 hours a week because of other things, and then that person's getting not just less salary for working that, but that employer can't afford to pay.
I'm a little bit luckier in the fact that I'm in Illinois, so therefore my part-time person has 2 small children, and she is eligible for Medicaid expansion. So therefore, it just, when you look at how much it would cost, so first of all, then since she's a young woman who's of childbearing age with 2 small children, she was pretty costly. So she's on Medicaid.
Okay. Well, I have to ask you this. Why is it that you choose to pay health care as small employers when you know that your competitors do not have to?
It's the right thing to do. And I'm a physician. Healthcare is what I live and breathe, and I have to, my employees I consider are my most precious people in my business. They help keep my business going. So, and they're my friends. So therefore, I want to keep them healthy.
In this system, it's the right thing to do. That when you own a business in a community, what you're saying is, I'm going to obey the community standards about that business at the very least. You know, the minimum wage, the health and safety regulations, the building codes. You're committing to that. Beyond that, inside of any really working business that has, especially where the owners work with the employees, you're trying to build a community inside that business.
Right.
A culture of mutual reinforcement and mutual help. And the easiest way to show that and to provide a really useful one is health insurance. You know, my primary management tool was a thing called Maslow's hierarchy of needs. Which essentially was designed by a psychiatrist, I think, in the 1940s.
Long time ago.
Which basically is a pyramid of foundational needs of human beings in order to lead a creative and positive life.
And security is right in the middle of that.
Security is
We're going to have to take another break, and we'll be back in just a minute.
The American taxpayers are saddled with the poorest in our society and the oldest, and those who are with chronic disabilities and those on dialysis. And we're putting them in the government programs and saying, all you healthy people from 18 to 64, we're going to hand it over to private insurance companies. And still, even with doing that, Medicare manages to actually control healthcare costs better than the private insurance companies can.
It's the system as a whole that creates the inefficiency. The fact that there are so many different payers and so many different plans and so many different ways in which bills have to be made and collected.
So having multiple insurances and having multiple ways of even billing for that patient is adding to the inefficiencies of the patients. You look at quality and variability, they're opposite of one another. The more variability that you have, the more entities, provider, payer, insurance manufacturers, and so on, the more chances of error, the more inefficiencies, the more cost.
One of the reasons why hospital bills are so high, why we are charged so much by doctors, is because they have to spend a lot of resources. They have to hire staff who do nothing more than engage in a nitpicking war with insurance companies on a daily basis to make sure that they are getting paid appropriately.
It makes me angry to see so much waste in healthcare, that there are nurses who are pulled away from actually providing hands-on patient care, and they're pulled into administrative duties. And they're pulled into those duties because we have an incredibly complex billing system. We have many different payers in our billing system. We have people who can't pay, people who have this insurance, people who have that insurance. So there's nurses whose full-time job is to help get authorization so that a patient can get the care they need. And that's ridiculous.
MCS pays $1.5 million a year for its health insurance. And where does it go? 3 cents of every dollar goes to an insurance agent that represents MCS in selecting an insurance plan and negotiating price. The next 20 cents of our premium dollar goes to the insurance company for its sales and marketing expense and for its staff to pre-approve and deny care and its administrative expense. And then you have at the provider level 10 to 15 cents that goes to hospitals and doctors to interface with my insurance company. They face massive amounts of paperwork and phone time dealing with pre-approvals and denials and payment issues. None of it is related to care. That's 33 cents of our dollar before the actual cost of care is paid for. My insurance company is supposed to negotiate better prices from the providers, but on average, they end up paying 20% more than Medicare does. They pass that extra cost on to my company. I don't see what private insurance brings to the table.
Welcome back to Green Time. I'm host Don Fitz. We are talking about small businesses providing health insurance. And with me I have Pam Gronemeyer and Lou Prince. Now, the question we want to end up on is, where do we go from here? Lou, where would you like to go with health insurance?
I think providing health insurance through businesses is haphazard, inefficient, costly, and the wrong way to do it.
Leaves out a lot of people.
Exactly. What we need is a national health insurance single-payer system, which would give basically everyone in the country access to the equivalent or actual Medicare, Medicaid, pick one. The costs in it actually are always overstated by the people who are against it, because when you take out the 20% minimum that insurance companies get for cost and profit and compare it to the 1% that Medicaid costs in cost and profit, you could insure 20% more people than are currently insured. Using the current pool of money, insuring people, all you'd have to do is convert that money from individual business expenditures to some sort of national tax plan.
Pam Gronemeyer, what do you think, where would you like to go? Are we talking about the same place?
Well, yeah, I'm a physician, and I know I have experience with Medicare, not being a patient yet, but being a person who's seen Medicare work. Medicare works, and it can continue to work. I mean, basically, single payer for all would expand your pool of people, would all be contributing, and it's not free. We're all contributing as we can afford to pay. So it would have health care from cradle to death. We wouldn't have to change jobs. When we change jobs, we wouldn't lose our health care. It's a way to go, and we can control costs the best way.
And as an employer, you wouldn't have to worry that you would go out of business because 1 out of 4 people had a very severe illness or prescription.
No,
so, I want to thank both Lou Prince and Pam Gronemeyer for participating in the discussion. I want to thank everybody at home for watching this episode of Green Time. Please tune in next week.